Hello and welcome. Today we're diving deep into a serious infection of the colon called pseudomembranous colitis. It's a condition that often arises from antibiotic use and can lead to significant digestive distress. Join us as we explore its causes, symptoms, diagnosis, and treatment. So, what exactly causes pseudomembranous colitis? The primary culprit is usually an overgrowth of a bacterium called Clostridioides difficile, often shortened to C. difficile or C. diff. While C. diff can naturally reside in our intestines in small numbers, it's typically kept in check by other beneficial bacteria. However, when broad-spectrum antibiotics are used to treat other infections, these medications can wipe out much of the good bacteria in the gut. This creates an opportunity for C. diff to flourish, multiply, and produce toxins that damage the colon lining. While antibiotic use is the most common cause, it can also arise rarely after some surgeries, prolonged hospital stays, or in individuals with weakened immune systems. Let's delve into the pathophysiology. Once C. diff overgrows, it produces two main toxins, toxin A and toxin B. These toxins bind to the cells lining the colon, causing inflammation and cell death. This damage leads to the formation of pseudomembranes, characteristic yellowish, white plaques composed of dead cells, inflammatory cells, and fibrin that adhere to the colon's surface. These pseudomembranes disrupt the normal functioning of the colon, impairing its ability to absorb water and electrolytes, ultimately leading to diarrhea and other related symptoms. Pseudomembranous colitis, while not incredibly common in the general population, primarily affects those who have recently taken antibiotics, especially broad-spectrum antibiotics. It's most prevalent in healthcare settings, such as hospitals and nursing homes, where antibiotic use is frequent and C. diff spores can spread easily. Elderly individuals and those with underlying health conditions or weakened immune systems are also at higher risk. The incidence has been on the rise in recent years, potentially due to increased antibiotic use and the emergence of more virulent strains of C. difficile. The signs and symptoms of pseudomembranous colitis can vary in severity. The most common symptom is frequent, watery diarrhea, often accompanied by abdominal cramping and pain. Some individuals may also experience fever, nausea, loss of appetite, and dehydration. In severe cases, the condition can lead to toxic megacolon, a life-threatening complication where the colon becomes severely distended, potentially leading to perforation and sepsis. If you've been on antibiotics and experience persistent diarrhea, it's crucial to seek medical attention promptly. Diagnosing pseudomembranous colitis typically involves a stool test to detect the presence of C. difficile toxins or the bacteria itself. Several types of stool tests are available, including enzyme immunoassays, IAs, and polymerase chain reactions, PCR assays. In some cases, a colonoscopy or sigmoidoscopy, procedures where a flexible tube with a camera is inserted into the colon, may be performed to visualize the pseudomembranes directly and rule out other conditions. Imaging studies like CT scans are rarely used but can help identify complications such as toxic megacolon. While the term pseudomembranous colitis is most commonly used, sometimes the severity is classified as mild, moderate, or severe based on symptoms, lab findings, and the presence of complications. Some classifications also take into account whether the infection is the first occurrence, recurrent, or refractory, meaning it doesn't respond to initial treatment. However, it's essentially all referring to the same C. difficile infection affecting the colon with pseudomembrane formation. The primary goal of treatment is to eradicate C. difficile and restore the balance of gut bacteria. This typically involves discontinuing the antibiotic that triggered the infection, if possible. The most common antibiotics used to treat diff infection are vancomycin and fidaxomicin, administered orally. In severe cases, intravenous metronidazole might be considered, although it's generally less effective. In addition, supportive care is crucial to address dehydration and electrolyte imbalances. In rare and severe cases, surgery to remove the affected portion of the colon may be necessary. Fecal microbiota transplantation, or FMT, where stool from a healthy donor is transferred to the patient's colon, is an increasingly recognized option for recurrent C. difficile infections that have failed other treatments. Preventing pseudomembranous colitis is crucial, especially in healthcare settings. Judicious antibiotic use, prescribing antibiotics only when necessary and choosing the narrowest spectrum antibiotic possible, is paramount. Strict infection control measures, such as thorough hand hygiene with soap and water alcohol-based sanitizers, are not as effective against C. diff spores. The use of personal protective equipment like gloves and gowns, and meticulous cleaning and disinfection of surfaces, are essential to prevent the spread of C. difficile. Probiotics may play a role in preventing C. diff infection during antibiotic use, but the evidence is still evolving, and more research is needed to determine which strains are most effective. The prognosis for pseudomembranous colitis is generally good with prompt diagnosis and treatment. However, recurrence is a significant concern, occurring in up to 20–30% of cases. Factors that increase the risk of recurrence include advanced age, underlying health conditions, and the use of certain medications. Recent research focuses on developing new treatments to prevent recurrence, such as new antibiotics and fecal microbiota transplantation. Scientists are also exploring the use of vaccines against C. difficile toxins to prevent infection in the first place. Understanding the complex interplay between the gut microbiome, antibiotics, and C. difficile is crucial to developing more effective prevention and treatment strategies in the future. Thank you for joining us on this exploration of pseudomembranous colitis.